Good evening, everyone. I'm Mason Hostat with Garco County Public Health, and I want to thank you for joining us for our ongoing Let's Chat Mental Health series in coordination with the Garco County Public Libraries. This series is intended to help break down stigmas associated with mental and behavioral health, while also offering people resources and ways to help those in their life who may be living with mental health issues. For February, we are going to be discussing anxiety and anxiety disorders. This topic is very close to me as I live with social anxiety disorder and generalized anxiety. Saying that, these sessions should not be used in place of seeking out mental health services for yourself or someone in your life who may be dealing with anxiety. Getting into therapy and gaining new tools and practices has really been helpful for me. I want to take a moment to thank our panelists today. I would start with letting you introduce yourself and answer the question, why is this work important to you? I'll let you interpret that as broadly or specifically as you want.
Hi, I'm Ann Nickman. I am a therapist and a program coordinator at My Springs Health. This work is important to me because I grew up with parents who had anxiety issues. And I think I always wondered how to soothe that or how to deal with that. I was also a very anxious child. So it's really important to me to help people understand that it's treatable and provide that support.
Hi, my name is Katie Foreman. I am a provider at Mountain Family Health Centers in Glenwood, and mental health treatment, therapy in general is something I'm passionate about. Anxiety is very much a part of that for personal reasons with anxiety, but also just knowing that it can be overcome, it can be understood. It also doesn't need to be something that's feared or controlled, but really just understood.
And I'm Jerry Rollins. I'm a social worker at Mid Valley Family Practice, and I so I'm passionate about this for similar reasons as what Ann and Katie said, and just that I think our community, the communities that we work in, this is anxiety, depression, substance use, are all things that they get in the way of us like thriving and being better neighbors, being better community members. So I think that is one way that I try to intervene and make this community the healthiest it can be by addressing these things.
Nice. So we always like to start with basics. We hear that anxiety is one of the most common mental health issues. But what is anxiety?
I'll go
I
first.
love it.
Okay. So I think of anxiety as this cluster of symptoms, and the way I always describe it is that it is physiological. Like it is our body responding to threat of some nature. Sometimes that is a perceived threat. Sometimes it's an actual threat. And the way that I really spell it out is that it's on a just like in anything in like therapy and social work, it's on a continuum. So I say, so anxiety is on a continuum. On one side is worry. We all worry, and worry is natural. It's something that separates us from animals, so we can think about the future. And then on the other side of the spectrum is panic, and anxiety is somewhere in the middle. And there are ways it's normal because it's our body's way of responding to threat, and it's sometimes it becomes an issue that really impacts someone's life. So that's my basic intro that I started with.
I like to add on to that too, in that anxiety is so uncomfortable that often we distress about anxiety. And what we know about anxiety is it could start about this and it can get bigger and bigger and bigger because it can grow. And so part of what we think about with anxiety is the anxiety piece and the distress piece, and we try to really make it more tangible to understand, all the different parts of it.
Another thing I think I have in my mind is how much anxiety wraps around future fears and a focus on dreading something or some kind of impending doom, right? That there's something out there in the future that we're worried about or we're projecting about as fearful. So for me, I think that's oftentimes what I see anxiety is just this fear-based worry about future outcomes that are really bad or terrible and maybe overblown at times in our own minds.
I like this idea of it can grow, because, sometimes. I was talking to somebody today and they were talking about, their worries that they have. And, it was how they just kind of ricochets off of each other, and then it just starts getting bigger and bigger. Whereas like when we think about inflexible, how would inflexible thinking come in then too? So I'm thinking about suicide prevention, right? And talking to people about helping somebody when you're in that constricted kind of mode where we say cover these thoughts, whereas somebody who may be dealing with an anxiety issue, it's like this big instead of. And we can get to that later.
Yeah.
That's just something that I'm gonna put a pin in that right there, and we'll talk about that when we talk about other things. So can anxiety be good?
It doesn't always feel like a good thing. But what we know about anxiety is that on that side of the spectrum where it's worry, it's heightened awareness, it's a little bit of energy, there are really positive aspects of anxiety. It makes you more alert, thoughtful, present, when it's kind of the right amount. And then also sometimes the anxiety and the feelings of excitement can be misconstrued, can feel really similar. And so a lot of times there's a little bit of excitement in there that's hard to tease out too.
Yeah, I always think about test anxiety, right, or before a race or something that you need to perform for, like you're utilizing that anxiety can be fuel, right? When you think about it that way, that it can motivate you to prepare. So that's one positive I think.
I good or normal is like the way I would.
It's good. It's good.
Like
Good word.
it is normal, it's neurotypical to have that anxiety. It's not something we should be afraid of. Because all these things that Katie had said are absolutely true. Yeah.
I like the idea of it being normal, right?
Mhm.
It gives the idea that there are going to be times in which you have anxiety, and those things are normal.
Yeah.
And because then the distress, right? Distress that can come from, oh, I'm having this anxiety and this isn't normal.
And I think, right, the panic of people are going to see me being anxious, and that is so horrible.
That's a good. That's I think especially for young folks, all our teenagers and adolescents, that that anxiety about anxiety, the meta anxiety.
Are you kidding? Do you know what? I have meta anxiety. And then I have to actually think to myself, okay, not everything is about your anxiety. It's not this thing that you're dealing with right now is not about your anxiety.
That's the beauty of maturity, is being at that point where it's like, oh, I have the same anxiety I had 15 years ago, but
yeah. And so, we don't necessarily need to get too far in them, but what are some you talked about the physiological, what are some of those physical components of anxiety?
So I think like the common ones that I hear people talk about is anything with the gut, right? Like people having upset stomach is one. Sweating is one. Frequent urination, hand sweating. There's so many things that anxiety can do and can present as. That's why I always frame it as a physiological thing, because somebody's like, oh, my feet are sweaty, is that normal? Yeah, absolutely. That's your body is responding in this way.
So it could be different for each person.
Yeah, that's what you're right.
I think it's helpful to name that it could be like what we would call ruminative thinking, so just cycling over and over again in your head, thoughts coming in when you don't want them to, can be a symptom of anxiety, maybe not just anxiety. So there's kind of that mental piece, that worry, that fret. There's the tension in muscles, in your face, in your chest, in your neck. Some people can feel it as heat. There can be like hard to breathe. But I agree, it's important to know that it can manifest for people in a bunch of different ways. Stress, headaches, some people feel exhausted. Some people can't slow down.
Yeah,
I will say for kids, what I find is that often it's in the gut. Yeah, like if the kid is talking about their tummy hurting or having an upset stomach, I'm always wondering about anxiety. Where else is that showing up a lot for them? So to me, that's like, it's almost it's not one-to-one like tummy upset and anxiety, but it's close in my world.
yeah, yeah, I mean, and being able to describe it in that way, like my tongue is upset, and it could be, it could be other things too, but I like that idea. Okay, what about panic attacks and how are they linked to anxiety?
I think panic attacks stem from, it's sort of this rolling process, right? Where I think there's a fear of something that becomes so real that when the panic sets in, it feels like someone may think that they're dying or having a heart attack. And when they don't know that they're not going to die or have a heart attack, that panic rises up even further and becomes so overwhelming that it can be really medically, almost like a medical emergency, right? And I think it feels like.
Characteristic of panic attacks is worry about another panic attack. So there's anxiety in between the attacks, so that anticipation of another one happening, and that lack of control or just waiting. So that can be just really impactful as well. And I think of panic attacks, maybe rightly or wrongly, as just your body has kind of gone beyond that. The boundaries for you of like that anxiety spectrum, and can take some really serious intervention to try to help re-regulate through breathing, through distraction, through sensory changes, all the way down to medication interventions as well.
And I think the confusing thing is that you don't necessarily have to have a history of anxiety disorders to have panic attacks. And there doesn't always need to be this trigger that causes the panic attack.
Right, which
I
is
think
so confusing.
That can be really confusing, and that's scary for people where the worry comes in for that, oh, what's the next one gonna happen? Whereas if there's continuous anxiety, or there's this like clear, oh, this happened, and then I have this anxiety attack or panic attack, then it's a little easier to understand. But when there's not that clear trigger, it's really scary.
I definitely have had clients talk about waking up with a panic attack, literally from being asleep into having a panic attack, right? So talk about no triggers. You were sound asleep.
Yeah. Why are some people more likely to develop anxiety than others?
Good question, which I think will get some good different answers in some degree. I can start. I'd love for you all to fill in where you think, but you know, there's so many different components. We talk about potential genetic predisposition. Some people can link anxious temperament or personality back generations based on, you know, family history. There's sort of the debate between what we say near nature and nurture and what genes really are. And at the same time, you know, you think about what early life experiences were like, in terms of experiencing safety as a young baby in utero all the way up to early ages in terms of perceived safety with caregivers, having your needs met, having an ability to be expressive. And this is one approach to child rearing, but I think that those can impact a person's experience with anxiety or being able to identify and express their needs, being safe in their environment, being able to feel like others are trusted. So you're taking two very different experiences and seeing if the two have any overlapping impact with one another to maybe make you more sensitive or vulnerable. That's how I don't know.
I agree with you. I do think it is this like holistic, looking at the biology of somebody and psychology of somebody. You know, I'm, as I think we all are, trauma informed, so like looking at how those early influences are turning on these systems within our brain and within our body, nervous system, to create that anxiety. So yeah, so I think that's kind of like that, how that develops. And it can be, you know, one thing we haven't talked about is our phobias. So like those specific phobias or things like that, those are typically based on a trauma that occurs, and then you can have that, okay, here's this intervention around a specific issue. So I do think it's more trauma that turns on anxiety system.
Yeah, I tried to cure my arachnophobia by watching that movie, Arachnophobia.
Did exposure therapy
Yeah, when I was a child on my adult, and it didn't work.
It didn't. It's a shock.
Yeah, I mean, whenever, when it was on like HBO or whatever,
Yeah.
and I was able to watch it for free, like I didn't.
Yeah.
It did not help.
That's amazing to do that for yourself as a child. So
You were sure your answers back.
Yeah, yeah, well, I was like, oh, well, I don't
Do
be,
this.
yeah, I don't want to be scared of them, they're not scary.
Yeah,
And,
wow.
okay, anyways.
Jared, I'm so glad you brought up the trauma informed piece. I feel like, right, with what we know now about post-traumatic stress, right, and so many big T trauma, little T trauma, right, how that can induce a lot of different ways anxiety shows up. But it also gives us that nice map to kind of try to lead back to where this started and actually face that,
Yeah.
you know?
Yeah, I mean, that's it, right? It's like trying to figure out where it started and what's the puzzle to put it together to give that person the tools they need as well as the understanding to be like, oh yeah, that's why I react that way.
And it
And
makes
it
sense.
makes sense.
Why wouldn't a human being be anxious after going through what you did, right?
Mhm.
Based in your death experience or something that felt that scary to you, so of course.
Which is like that panic, which is like a panic attack, right? Like that feels like.
And then there's a panic attack trauma.
Yeah.
And I love what you said, right? It's like the lifespan and attachment, right? Attachment to our family. What did we experience as an infant, even or toddler, that we may not even know that our parents were projecting about safety in our environment, right? Or school, school anxiety.
Right. And so, I think you kind of answered the next one. Does anxiety look different in different populations? I was talking about children and adults, and I think kind of answered that, but if there's something else you want to.
I wonder if either of you have more experience with kids, but even thinking about OCD and seeing like tendencies towards compulsive behaviors or, not even compulsive, but obsessive behaviors, and if that looks different that you've seen among children in New Wave and adults.
That's good. They have a very similar flavor, I would say, like OCD and anxiety. I would say that and I'll say I'm not an expert in
We
OCD.
can all claim that. Okay, just like.
Definitely.
But what I've seen is that when it turns to OCD, there's more distress around it. There's even more avoidance of the stressor. And it's not logical. I think it's like one of the big things. Like with anxiety, I do think there's this again, we could chart it out and say this. With OCD, it's not as simple in my experience. It's harder to say okay, this is why it is. And I would say it's more insidious and kind of
I think kids too, I know adults have nightmares, but I feel like the kids I've seen, that's kind of a key component that I notice comes up is that it shows up in dreams or nightmares, waking up night after night with these night terrors or fears. I'm not sure why that is. I never seem to notice that among kids.
When does anxiety move into an anxiety disorder?
I think it's what you said, Kitty. That it's that distress, like when it moves into distress, and
Right.
and I think that's true. Any disorder that we use, that's a key designator. It's once it moves into distress or it really impacts someone's life, then it's a disorder.
Do you mind if I give the definition from mental health first aid?
Sure.
Okay, so the three things would be if it interrupts activities of daily life, job, work, or school, and then relationships, which is what you're saying, when it impacts life, but for non-lay people, like those three things, if somebody in your life is having this issue and, they can't go to work, they don't shower, and then, they are really engaged in their relationships would be something that I would look at as a lay person.
The only other component, if you're looking at it to meet diagnostic criteria based on our diagnosis manual, if you will, but is also just duration of time. So how long have you been experiencing these symptoms? And then level of distress or impairment of functioning in these specific fields, whether it's generalized, it's happening kind of randomly throughout the day, it's specific to social interactions with people or social relationships with others. There's different kind of qualifiers.
Yeah.
One thing that stands out to me too, that I've noticed or talked to people about is that your worry tends to span all these different arenas, right? It's almost like you can just be worried about everything, right? There isn't necessarily one track to the worry, I'm worried about multiple areas of life and the world and multiple pieces to that. It's not just one thing.
Yeah. And it's the perceived distress of that, because I think sometimes I make the mistake of being oh, well, you're fine. You're crushing it at work, or you're crushing it in relationships.
Yeah.
But underneath they're not able to manage that, and so that's true too. It's not always evident that there is that anxiety. We're really good at hiding it.
I think that's a big piece too, when you're talking about different anxiety experiences across the lifespan. The number of teens that I talk to who think they're the only ones who are experiencing anxiety is amazing to me. When I have you talked to anybody that also experiences anxiety? And they say, no, and I'm like, well, at least 30% of the kids in your class experience anxiety, so go start talking.
Yeah.
I love that.
I still think that sometimes, and then I have to, one of the practices that I do is I try to, in a meditation, is to open myself up to the idea that I am not the only person who's doing this, who is feeling these things. Because it can be so isolating when you think that you're the only one big thing you don't think you're.
I'm relieved when I'm like, I feel anxious right now. I'm like, me too. I'm like, oh, thank you.
Yeah. It just takes one person to say it.
Yeah.
Yeah. So will somebody who has anxiety develop an anxiety disorder? Does this kind of get back to the the duration of anxiety symptoms and also that anxiety can be good, anxiety can be beneficial and, so then thinking, oh my gosh, am I one of the people who is gonna develop a disorder?
I think it's really important for a person to define it for themselves of how impactful the experience of anxiety is and what their goals are for quality of life. I mean, that's how I would move forward because there are plenty of people who have anxiety where it's motivating, it's driving, it's benefiting them. But I would say that that's a high level of anxiety. For them, we're not going to touch it.
Okay.
But I do think sometimes it does take an outside perspective also to say, this seems like you're trying really hard, you've tried a lot, and it's still making your quality of life not as where I think it could be. So there's both internal and external.
I mean, we do have a lot of, I think about the individuals who may compete like in the X Games or, Michaela Schifrin who talks about, I don't know how much she talks about her anxiety. But we live in an area where there are people who push themselves a lot. But yeah, I'll let you two respond. The idea that somebody with anxiety develops an anxiety disorder.
Yeah, I think the short answer is no.
Okay.
Not even a little bit. Yeah, I think I don't I wouldn't start there, right? Like if somebody's coming in complaining about anxiety or concerned about it, I'm not gonna say like, oh, you have an anxiety disorder.
Okay.
Right off the bat. I'm gonna sit with them really and try to understand where it's coming from. And not even use the word disorder. To start.
Yeah. It's interesting to think about what would drive a person to come into therapy regarding anxiety, right? I think it has to get to a point where they're willing to come in, open up to someone and pay for treatment, right? So I think the people we see maybe further along with that. The general public.
Yeah, I think that's a great point. Like
right.
all the settings that we work in,
We're always
the rate of anxiety is going to be higher than the general public.
Right. And knowing that everyone has anxiety, it doesn't mean that they're necessarily with a therapist or getting medication.
Yeah. Okay, I appreciate that. Okay, so just trying to move the discussion now to treatment and therapy. What types of treatment or therapy are available for anxiety and anxiety disorder?
Many.
Yes. Okay.
I'm just gonna do short answers from now.
I know, we're gonna do longer ones. Come on, here.
No, many. I think anxiety is probably one of those disorders or experiences of life that are well studied, and there is a lot out there. And there's a lot an individual can do on their own without therapy to stem the tide of anxiety. My main thought, and kind of what you were talking about, Mason, with that like inflexible thinking of it. I always say like anxiety wants you to avoid. So like anxiety is avoidance. And so my first step in any treatment is really trying to work through that avoidance reflex, that anxiety wants. It's not the person that's trying to avoid it. It's the anxiety that is that's causing it.
Okay.
So I try to separate the two, the individual and the anxiety, and then just talk to the anxiety. What is it wanting you to avoid? And let's talk about there, and let's talk about that. And that's like, some like people are asking like cognitive behavioral therapy or exposure therapy if it's done systematically, not just turning on a random phone out when you're a kid.
Yeah, not great. In the dark.
In the dark. Nice.
When no one else is at home.
But I think that's like where I start. It's just that is working on avoidance. Because until you get through that part of anxiety, it's really tough.
Some insights about things that I'm having them anxiety over and then I'm avoiding them. Think about
You're like, okay, now we're.
you don't have to charge me. But thank you.
I think this goes along Jared's point. When we experience anxiety, our body is primed to sort of overreact and be sensitive to triggers. And what I think about with therapy is it's a place to kind of learn and understand that. So just the education around that. So you feel a little bit empowered to separate yourself from your anxiety, just like Jared said, but then also to start to figure out ways where you can expose yourself, not just exposure therapy, but like in relationships with vulnerability or with being kind of more grounded, helping your body feel more grounded over time in those kind of triggering environments with the aid of somebody who kind of can make that a process that you're not too afraid to engage in, but it ruffles you a little bit. You want it to ruffle you, but not make you feel like you're going over the edge. But also it's as simple as like, how are you eating? How are you sleeping? Are you drinking caffeine all the time? Are you exercising? Are you doing things that give you pleasure? Like all of these pieces can impact how primed our body might feel. And so just that mindfulness of not only how to best take care of your body, how to then soothe your body kind of systematically, is one other point I wanted to make that I'll.
Yeah, I like that. Because I've been doing some of those things too, like mindful eating and chewing. I know.
MBSR.
Yeah,
Yeah.
but kind of.
MBSR is
Mindfulness-based stress reduction. So there's a
That's right.
couple of different ways. This is what I was going to say is also learning to sort of differentiate yourself from your anxieties. So like even doing something as simple as sitting there and noticing your mind's tendency to shoot random thoughts into it. And instead of feeling them, being them, almost being able to separate yourself and just watching it go by as if it was a train passing by, a car going by. That's a mindfulness exercise. So you can start to be curious about your body's response rather than your body's response.
Yeah. What is SR? Sorry, I got mindful.
MBSR, mindfulness-based stress reduction. So you'll hear people talk about eating a raisin and paying as much attention as you possibly could to one raisin in your mouth. Taking a shower and feeling every element of where it's touching your body and heat, temperature, regulation differences, things like that.
One thing that I'm thinking about as we're talking also is ways of regulating that have to do with other people. So I do a lot of couples therapy, and in emotionally focused therapy, there's this focus on attachment, and that your attachment figures can actually help you regulate as well. So being near someone that is safe for you and will hold your hand is something that can help you regulate your nervous system, right? Or for a child to know that they're near a parent or somebody. And in EFT, you can even talk about, okay, visualize that person in your mind when you're feeling anxious and distressed, and that can actually bring your nervous system into regulation as well.
EFT.
Emotionally focused therapy.
Okay.
Yeah.
The thing you said, I want to make a point of, First of all, with kids, anxiety comes from not knowing or kind of not knowing like if something is happening and they're being withheld that information. And so narratives that are age appropriate can be really helpful. But also for all ages, visualization is just as important as going through the real thing. So if you have an experience that you're anxious about, envisioning it in your mind, all of the different components of it, and you doing it in a way that makes you feel more calm or grounded or proud over and over again is priming your body as if it was actually happening. And so visualization is another technique that we use.
I use visualization in my time of big mountains.
And do you visualize getting to the other side?
Yes.
Nice.
Yeah. And being successful.
And feeling proud of yourself.
You got there.
Jared, did you have anything else for this?
Another one word.
Another one. I think, again, if you're like looking for specific interventions like the mindfulness-based stress reduction or EFT, I think somatic therapies are really powerful with anxiety specifically, and somatic therapies is really like what's happening in our body, what's happening to our central nervous system, how are we moving through this fight or flight response, and because sometimes again, this idea that it's normal and typical to have these anxiety responses, but how do we move through that and then come back down into a state of rest?
Yeah.
So that's another thing folks can look into.
It's really easy to monitor. So something as simple as a pulse oximeter on your finger can show you what your heart rate is or your oxygen levels. And as you become more activated, you notice that changes, that information changes as you do something that might be a little bit more regulating, then you see it changing. And so you can just develop an awareness of all the different ways your body reacts, responds, and then what you can do to help with that process as well.
So when I always kind of ask this question, probably but in different ways, but what should people, most important things, want to think about before seeking treatment for anxiety?
Most important things.
Yeah, so, I'm thinking about the layperson, like what, is it? No, I don't know. It is a difficult question.
I like that question, actually.
If you could tell a person who's gonna come and see you for anxiety, what they could expect when they come in. That might be a better way of thinking about it. What they could expect when they come in to see you.
I think about how anxiety provoking it can be to meet with a therapist, not knowing what to say. Am I saying the right thing? Am I boring them? What are they gonna think of me? When I do share this, how raw I feel afterwards, and then how do I take care of myself after doing that? Do I want to do that again? And so I think giving yourself credit for showing up, vocalizing the anxieties that you're experiencing. The therapist hopefully is not meant to judge you. We meet with people every day who experience this. But knowing what you're experiencing is helpful for us. So I am definitely in that category of going to my own therapy and just being really nervous that am I doing it right? Am I saying things? I don't know how to define my anxiety. I don't even know what my symptoms are. Sometimes I can't even tell until I'm really far past it. It took me a really long time to get to where I felt like it actually makes sense. I actually have language for it. Don't actually care what my therapist thinks about me. Things like that.
I think that's really profound, Katie, that you are a provider and you were talking about your own anxiety, your own, because you have these tools and other things to be able to help others, but it could be not necessarily, it could be can be just as difficult to do it for you inside your head.
I still go to parties and have social anxiety and then get really pissed at the old patterns that come up when I'm like, I've been through that. But I still feel really anxious about what people think about me, or did I say the right thing, or I still have it myself. I've been in therapy for many years. I do therapy. I intellectually now know it, but my body still has the same reactions.
Thank you for,
Yeah,
yeah, I appreciate that.
I'm happy to talk about myself.
But I'm really going back to one of the things you said about when you're dealing with like your kids or teenagers. Just this idea that if I'm gonna go and see somebody about my anxiety issues, this is probably not the first time that my therapist today has heard somebody talk about their therapy, you know? I'll let you guys talk.
I think, what someone could expect hopefully is just a patient process where there can be an unwinding of information and discussion about why particularly for this person, they feel the way they do, right? An exploration, that there's not a race to get to like some perfect answer, but hopefully it's a thoughtful discussion about symptoms, an idea, an education about what treatment looks like, what it means, kind of a map. I like to try to give people somewhat of a map, right, where we're headed, or these are our options.
That's what I thought about when you were doing your research.
Yeah.
And that it's kind of a maze or a map.
Right, that we get there together.
The other thing I think about that, a lot of people experience anxiety as a weakness. So we did talk about, could it be a good thing? But I think across mental health, in general, it's if I'm feeling this way or I haven't figured out how to manage it weak, or within families, views on it are different too. And so just being mindful that can make it really hard to come to therapy too.
Yeah.
Or to talk about it in families.
So Katie and I both work at like a medical office. And so that's where I see a lot of folks come in who they're worried about. Again, it's that like physical symptom is showing up, whether it's like heart issue and they've done all the tests, or the kid with stomach issues. Sometimes that's where like that's a way into treatment, is like through your doctor's office and you've done all the tests. And cleared out, yeah, you got physically, you're healthy. Then it's time to start like, okay, how else can I approach this issue?
I'm gonna kind of combine this. Does treatment for anxiety differ from other mental or behavioral health issues? And then length of time. You know, we kind of talked about duration as part of the thing that moves somebody from having anxiety to disorder. And does it depend on acute versus chronic?
I'm happy to hear what you all think about this. I think one of the things that is a distinguishing factor between anxiety and some of the other diagnoses that we come across is the role of medications. And so benzodiazepines like Xanax and Klonopin, they're one of those things that I discourage, really, because it's that avoidance process. Like all those things help you avoid. They reduce the person's resilience towards anxiety, and they just make that anxiety become bigger. Not to mention some other like long-term symptoms that happen down the line. Now, that's not to say that there aren't other medications that can help, but that is one, like people are like, oh, I just need like some Xanax or some kind of benzodiazepine to help. And I think that's a distinguishing factor. Like someone's coming with anxiety, I'm not necessarily talking about medications right away. So and I'm happy to hear their thoughts on that.
I think medical providers alike are now discouraged from using those because they they, exactly like Jared said, are not beneficial in the long run for the person. They're helpful in the moment, but we're really looking for something that's more sustainable and kind of a deeper approach. I think when I'm thinking about like chronic anxiety, I think about attachment related anxiety. So yeah, I think that's where, you know, the anxiety that I shared might be what you would consider attachment anxiety, and it will percolate for years afterwards. And it's more about recognizing my sensitivity in my own body and being thoughtful about it, in hopes that it gets easier or that I just know what to do with it. And so maybe this goes back to like distress. Mm-hmm.
I'm thinking about length of time for treatment and how that can vary. I've had some people who go through a course of, you know, cognitive behavioral therapy, and it really addresses some really specific core issues, and it can go fairly quickly. And then I think for other people, there may be some deep trauma or a much more involved reason for that anxiety. That can take a longer time, right? It can be a couple of years sometimes for certain people, just depending on the source.
There's good reason sometimes to have anxiety. When you think about like with trauma, it's not that you want to take away through therapy or treatment the impact of something that was impactful.
Right.
And so it's not that I'm gonna ever do away necessarily with it, but it's like this, hopefully the like sting of it, the disruption that it causes. Oh, yeah. I'm just
I like it.
throwing ideas.
Yeah.
All right, there we go.
That was good.
The other thing that I would add, this is, before we were talking just about alcohol. And I think anxiety and alcohol go hand in hand. Don't misquote me on this, but it's like, but alcohol helps anxiety.
In the moment.
In the moment, in
Right.
the short term, it's similar to like a benzodiazepine, works in a similar way in the brain. But again, it's that avoidance thing, and it is really bad for you.
Yeah.
We can start really talking about that, don't we?
Yeah.
Yes.
Yeah.
And so this idea, like sometimes what we're focused on is like the alcohol use, because that's the thing that is disrupting everything, and that's the thing that is distressing and really hurting somebody's life. But underneath it is this anxiety that we also need to talk about and address. So when somebody is with anxiety, I will ask about are you using any other substances?
Yeah.
Marijuana, cannabis. Those kinds of things.
But this speaks to like how complex mental health can get, right? Because it's substance use, it's eating, it's a relationship with food. Like binge eating can be a part of self-soothing with anxiety. Restricting can be a part of self-soothing with anxiety. So, you know, depression stems from anxiety sometimes. It's so exhausting to have anxiety and it impacts your life. So it can be something very straightforward. It can get very intricate.
Yeah.
So that question you asked, like, what would you look for like a therapist?
Yeah.
If your therapist is asking all these questions, and they just like minimize them, you're like, okay, you have anxiety, go do this thing, go walk and breathe.
Yeah.
I think that's what you should be like looking for or hoping for.
Yeah.
When you like start treatment. Because it is like, it's so complex. Yeah.
Years upon years, and you know, somebody who has dealt with anxiety most of their life, they probably have found those self-soothing things that make them feel okay. Our brains are wired to want to feel okay.
Right, there's something wrong with that.
And there
It's harmful to you,
Right.
right? I just wanted to say quickly, I'm just grateful that there is more information coming out about the harm of long-term benzo use. Because I definitely think in the past, it was pretty easy to go out and get a pretty regular prescription for that daily. And really to understand the impact of that on the body, and for a lot of doctors to start to understand that is not the solution. It's really important.
Gave me hydroxyzine.
Well,
I was 47.
okay.
Well, and some people
But
know.
I did do some Xanax before.
Right, and then most people have probably, right? It's just
Some
Is it
people
good?
like hydroxyzine, some people don't, because it can be sedating. Some people like gabapentin, some people don't. Totally. Some people think SSRIs are exactly what they needed. The, Zoloft, Lexapro, Paxil medications. So there are a lot of also medication interventions that I am not a psychiatrist. I have worked enough with a psychiatrist who said that there are no long-term risks associated with long-term SSRI use. No concerns for the liver, no concerns for those. And so I will caution one thing I do talk about with people with anxiety is if you start a medication, it's important to get to what we consider to be a therapeutic dose, like where you are feeling the effects, which can take 6 weeks plus.
Right.
And then to stay on it for between 6 months to 12 months, like that is kind of a recommended, if you know that you don't want to do it long term and there aren't risks for necessarily being on it long term, but you have to be willing to make a kind of a commitment because that is an important daily part of your routine.
Yeah. Yep, I love my SSRI.
Mhm.
I went off of it for a while
Yeah,
and
that's right.
then I realized I need to be on it.
Same.
Okay, we're gonna ask just one more question and then we'll move on to reducing stigmas. But what are some practical ways that family and friends can help someone experiencing anxiety? And this kind of gets to what I was talking about with like the big, like the worry is this big.
Validation or normalization of it, I think can be helpful. And what that would look like in my mind, anxiety is a physiological response. I don't know the right way to say. It can be very soothing. It's okay to have anxiety. It's really uncomfortable. It can feel really hard.
Do you all know Megan Hurley? Yeah, she says something, this was like years ago. She said something that stuck with me that I repeat often, which is your body's response, it's a normal response to an abnormal situation. So like that's one, I will say that to people all the time until that like becomes internalized. And if your friends and family can help you with those things, remembering those things are good.
A normal response to an abnormal
Situation.
Yeah.
Just speaking out loud, right? Allowing your family member and loved one to know that they can say that they're anxious and really talk about it. I think anxiety just thrives when you're quiet about it, right? And just rolling in it and letting it go. But yeah, feel invited to speak about it would be important.
How cool would it to be if like your family was involved in your anxiety plan? So buddy, you're having a really hard time. Should we watch a movie right now? Should we listen to music? Should we go for a walk? I don't need you to stop having anxiety. But why don't we shake it up a little bit?
So we always have our chats with the discussion around stigma and the ways that we can all work together to reduce them. We'll kind of make that for how can we help destigmatize anxiety in our communities?
I already hope and think there is a lot that's being done. I mean, we've called out the national crisis among youth having, mental health concerns. We know that social media is wreaking havoc on confidence and peer relationships. So I think there is really good awareness in a lot of ways. We know. So yeah, I think that it's a better time now to have anxiety than I think it has ever. Not to say that there's not room to grow. So I think part of this is just continuing to sort of normalize it, and then also what contributes to anxiety in terms of societal pressures, pressures based on like identity markers, internalized messages that we get.
Yeah, I wonder if, because I agree with you, like, and if there's anything that's been destigmatized, lots, I feel like it's anxiety. And there are still like certain populations where that's not the case, where that's not true. And I think maybe that's if we're gonna try to destigmatize it more, it would be in specific populations, whether that's with, I'll speak to this, like, men that are in construction. It's not okay to have anxiety or, high performing athletes. It's not okay to have anxiety. I think with our Latino folks, like that is not something that is necessarily talked about readily or within families. And so some effort there would be helpful. So I think as a whole, we're doing pretty good.
Getting there.
And there's specific populations.
I just want to say, I think that also doing things like this and making them public and free is really important, because I think it might be easy if you haven't been to therapy to have some mystery around that. And I think that if people can hear about what therapy is, why you would do it, what it looks like, that might invite people into that more easily. I really love free information.
Yeah.
Exposed widely.
If you could share one success story around this, what that would be great. And you don't necessarily have to, because we have like 5 minutes. But I love the success stories. I think giving people hope that anxiety is something that can be lived with, and anxiety disorders can be lived with, and people can have successful lives. It's important.
Yeah.
I'm just having a very personal reaction.
Sorry, Kate.
No, I mean, I maybe it's TMI, maybe it's helpful. I had crippling anxiety as a child, my 20s. I really strongly believe in the hashtag "it gets better." I'm really grateful for, and that's not true for everybody. Lots of people have different circumstances that make their lives really complicated and hard. So in that way, I feel really fortunate, but it's just really crippling anxiety, and I'm finally living, a happy life. And so not to make it personal, but I bring that same energy and hope to the people that I'm dealing with, because I think for many that's achievable. Because anxiety is horrible. The feeling physically, mentally, it's painful.
Yeah.
Can be. I want to follow my success story.
It's a lovely one.
I think so. I think one success story that I've heard is not necessarily in therapy, but this idea of people can discover these things on their own. And I think of people going out for hikes, people going out into nature, learning that their body feels different when they're out there and it's quiet. And I didn't necessarily have anything to do with that. Like, I can think of a few people who discovered that on their own and use this place that we call home to help heal from anxiety. And I think that's the good news of anxiety, that yes, therapy is good, medication is helpful. And again, things people do on their own to combat this.
It does not need to be in therapy. And I think a lot of people don't come to therapy because they have support systems, they have ways of getting those needs met spiritually, religion, through many different things. So yeah, I agree. I think the other thing, I do think knowledge is power in some ways. So even just something as basic of understanding why we experience anxiety, exactly what this thing is, can sometimes give people the tools to I've had people do their own exposure therapy when I just explain it, they can't drive, and I explain it, and I'm like, you gotta do it. Almost so it's so boring, it's tedious, and they'll come back and they're like, all right, it's not a problem anymore. And they do it on their own. So it's not true with everybody, but I do think knowledge can be really powerful.
Yeah, do you have a success story?
No, I'm sitting here just thinking about the gratitude that I have to be able to work with people dealing with anxiety and the joy of watching that dissipate through the process of connecting with someone else and walking through a healing journey around that, right? For me, that is always part of why I do what I do, and I just love it. To me, there's many success stories, right?
Yeah.
Out there.
Well, thank you all so much.
Thank you.
Do we have any questions? Check.
We have had quite a turnout online,
Oh, good.
just.
It's really exciting.
Well, we'll give it a second if somebody does have a question.
Thanks for joining.
Yeah, want to thank my panel members for being here and willing to take the time to share. If anything came up for you during this conversation and you need someone to talk to right away, please call the National Lifeline at 988. That is what they are there for. If you feel you might be ready for treatment or for your anxiety, please know that there are resources and providers out there. We will have our next session March 25th at the Glenwood Springs Library. March 30th is World Bipolar Day, and so we will be discussing that topic. I felt it's something I'm very fascinated by and interested in. Thank you all for joining our little but mighty program tonight, and we look forward to meeting in March.